Today I will talk about supply chain management with respect to a clinical laboratory. It is my series of lectures on clinical lab management and supply chain management. This is my lecture outline. I will talk about complete supply chain of a clinical laboratory. Then I'll describe in detail network design of a clinical laboratory. Then distribution network design of a clinical laboratory. Then I'll talk about special considerations in inventory management. So this is the complete supply chain of a clinical laboratory. There are many suppliers who supply reagents, equipments, and other consumables to clinical laboratory, and this part is known as supply network. Clinical laboratory gives services to patients, other labs, medical institutions, then clinical sample aggregators, remote collection center may be associated with clinical lab, and insurance firms or institutions for medical examination of their employees. This part is known as distribution network of a clinical laboratory. So I'll talk about these two. So supply network design of a clinical laboratory. A clinical laboratory requires equipments, small items, reagents, other consumables, and MRO items. MRO stand for maintenance, repair, and operations items. For example, A4 size papers, pens, etc. So this is supply network design. So there are suppliers. Some of the supplier directly supply to clinical laboratory. Some of the suppliers may supply to a distributor. This distributor may have a storage facility or may not have a storage facility. And this distributor supply in turns to a clinical laboratory. So this is about a simplified supply network design for a clinical laboratory. For a clinical laboratory, which is not standalone laboratory, for example, a laboratory which is part of a hospital, there may be in hospital uh, medical stores from where the reagents are supplied to a clinical laboratory, and those stores may procure the item from suppliers either directly or through intermediary distributors like these. Then distribution network design of a clinical laboratory. So clinical laboratory gives services to patients. So these are direct patients who come to a clinical lab for sampling, and the laboratory report is issued to the same patient or uploaded on internet. Then there may be other labs or medical institutions like hospital, nursing home, dispensaries, who may send sample to the clinical laboratory, and then reports are dispatched to those institutions. There may be clinical sample aggregators. Actually, these are questionable firms who collect sample from various locations, and they don't have lab. They just distribute their samples to various laboratories and collect report and give report to those sources from where sample was collected. And this system is actually a little bit dangerous system because of sample logistics. I have a separate lecture on sample logistics because sample repatriation may happen in such a system. There may be remote collection center associated with the clinical laboratory. The samples are collected and they are dispatched to a clinical laboratory, and then reports are then transferred to the collection center to be taken up by patients. Then a clinical laboratory also provide medical checkups for insurance and other medical institutions, and usually they are through a third party administrator or TPA who send client list to the clinical laboratory, and clinical laboratory either go to the for home sampling, or they may go to the institutes for medical examinations, or the patients or employees they come to a laboratory for the medical examination testing. So this is about distribution network design of a clinical laboratory. Then special considerations in inventory management. So in inventory management, there are three questions. Which item is important? The answer is by ABC analysis. I have a separate lecture on inventory management. The link is given above. The second question is how much to order? And the answer is economic order quantity. The third question is when to order, and the answer is order point method or order period method. All these I have described in my inventory management lecture. Then special considerations include these points I have taken from this handbook. The reagents can come in a variety of preparation, solid, powder, and liquid. Each test performed in a laboratory requires several different commodities or reagents, and the laboratory commodities can be packaged in kits. So for a particular test, there may be a kit which contain more than one reagents. So they may be packaged in kits for tests. Then some laboratory commodities have short shelf life, so they cannot be ordered in bulk. Some laboratory commodities have special storage requirements with respect to temperature and light. They may deteriorate in light and they may deteriorate in higher temperature. So they may have a specific temperature requirement, and even some may require freeze sub-zero temperature. So this is about special consideration. Then we can classify the commodities as reagents, consumables, durables, equipments. This is one classification. Then slow moving and fast moving commodities. The slow moving commodities are those which are not exhausted easily. They last long. And fast moving are rapidly consumable items. Then we can classify as long shelf life items and short shelf life items. I have already talked about that. We cannot purchase in bulk the short shelf life items. Then we can have a situation of non-full supply and full supply. Again, I have taken from this handbook. So this is all for today. Thank you very much.